Hello, I'd like to welcome the audience to a panel discussion about cervical cancer and the HPV vaccine. We have a panel group here. I'm the moderator. My name is Mike Fishbein. I'm a radiologist at Falmouth Hospital, and I also serve as the community outreach coordinator for the Falmouth Hospital Cancer Committee. And in addition, I have Jean Talbot here to my left, and Jean Talbot is an OB/GYN physician at Falmouth Hospital, and she also works for the nonprofit group PNCC, which is a group whose mission is to create sustainable programs to prevent and treat cervical cancer in developing countries. I have Peter Lind over here, who is a pediatrician who has been working with Falmouth Pediatric Associates for 13 years, and his wife Eileen is a nurse practitioner at Dana-Farber and also is a founder of Team Maureen. So January is Cervical Cancer Awareness Month, and since January is just around the corner, I thought this would be really a great opportunity to discuss what I think is really one of the most amazing stories in medicine, and that is the progress that has been made in first controlling cervical cancer and now really on the cusp of perhaps eliminating cervical cancer. So during the course of this panel discussion, we hope to tell you about this history and also tell you about really what's in the future for this cancer. But before getting too far ahead, I just want to bring you back to the beginning, which really I think starts maybe in 1930, which is when we didn't really have any real treatments for cervical cancer and there was no screening program. So let me just read a few statistics about cervical cancer in 1930. Cervical cancer was the leading cause of cancer death among women. It exceeded breast cancer and all other cancers at that time. Less than 20% of women survived 5 years after diagnosis, and the average age at diagnosis was about 40. So the impact of this disease on families and community obviously was enormous. And then in 1950, there was really an incredible discovery, and that was the Pap smear. And the Pap smear reduced cancer rates really within 10 years from an incidence of about 35 per 100,000 women down to about 8. So the impact of the Pap smear being what it was really transformed the diagnosis and treatment of cervical cancer. So with that being said, I'd like to ask Jean. Jean, what can you tell us about the Pap smear in terms of the impact that it's had on cervical cancer, as well as really what it is and what it tells us about cervical cancer?
Okay. Well, as you mentioned, the Pap smear has reduced cervical cancer rates in this country by probably somewhere between 70% and 80%. It's been a huge change. And it's done that because the Pap smear is designed to pick up precancerous lesions of the cervix. Cervical cancer is fairly unique, I think, in cancers and what we know about it and how it evolves. And we know that in most cases, it's triggered by a virus, which is the HPV virus. The virus is generally sexually transmitted. So people acquire the virus early on in their sexual lives. And it is often transient. It often will appear and then it'll disappear and won't cause any harm. But in a few women, or a small percentage of women, the virus is persistent. It just persistently causes changes, or they can come and go a bit, but over time it's persistent to cause these precancerous changes of the cervix. And it probably takes about 10 to 20 years in most cases for those viral changes to actually turn into a cancer. So the Pap smear has a lot of time. We have a lot of opportunity there to screen for precancerous changes, pick them up and eliminate them, or at least watch them closely to see if they'll disappear on their own. So that's probably fairly unique among cancers, is that we know how it develops. We know it develops slowly enough that we have an opportunity to identify it and treat it or eliminate the precancer.
So what is precancer? I mean, that's a concept that is a little bit new to me. For instance, when we think of cancer, you either have it or you don't.
Right. Yeah. Well, with cervical cancer, it is a continuum, and the other word for precancer is dysplasia. And basically, it's superficial cellular changes. The HPV virus gets into the cells that are on the surface of the cervix. and starts to change the character of those cells. And it starts very superficially, and over time, if it progresses, it's a thicker layer of that cervix that gets involved. And then eventually, it breaks through what we call the basement membrane and invades into deeper tissue. And that's when we have the diagnosis of cancer, is once it invades into the deeper tissue.
So as long as it's superficial, then we call it precancer.
We call it precancer or dysplasia, and we grade it as mild, moderate, severe, and our treatment, our management of it varies depending on the severity of the changes that we see. The pap smear is a test where we basically scrape off, use a brush and a little spatula to scrape off these superficial cells. The pathologists look at the nature of the appearance of those cells, the characters of those cells, and they can't really make a full diagnosis of cancer, but they can tell us how abnormal those cells are. And then it pretty much always requires a biopsy to confirm a diagnosis of cancer, because you're looking for invasion, and the scraping of the surface of the cell is often it'll make you suspicious, but it may not confirm the diagnosis.
So when you do a pap smear, the idea is to get cells from the surface, send those to the pathologist, and if they're normal, it's normal. But if it's abnormal, then you could be dealing with a precancerous condition. Correct.
And they will grade it for us when we get a report back on a pap smear. It'll be read out as normal, or there's an atypia, which is sort of an in-between, non-specific term. There's a mild dysplasia, moderate dysplasia, severe dysplasia, or the pathologist will often call it low-grade changes or high-grade changes. High-grade changes are more concerning, obviously.
So is it fair to say that if a woman is having her pap smears at a regular interval, that we should catch every cancer in a precancerous stage, or are there some that are aggressive?
We should be able to catch the vast majority of them if someone comes in for screening at appropriate intervals. The recommendations for the intervals have changed over time because we've learned so much of the pathophysiology of this HPV virus and of cervical cancer that we understand that the original mantra of doing a pap smear every year is not necessary, but regular screening is, and the intervals have now changed to be more 3 years, sometimes even 5 years if it's combined with an HPV test. But it is important to have repeated screens because each screen isn't perfect.
Right.
But we have that luxury of time in many cases because of the slow development of the cancer.
Right. So what age should a person start screening, and is there an age where a woman should stop screening?
We now start screening at age 21. And part of that is because we know in younger women, even if they may acquire the HPV virus, it's usually transient. And even if it persists, it would be very, very unlikely to become cancer before age 21. So the recommendations are to start screening at 21. And then if it's normal, you can screen every 3 years. If it's abnormal, then you go on to do additional testing to try to identify what the problem is. We are combining pap smears with HPV tests in women that are over 30. Because when the HPV persists on into your 30s and 40s, that's when the risk of cancer goes up.
So let's say you have a abnormal pap smear. Is there any way to treat the abnormal tissue at this very precancerous stage and eliminate it? Or do you just continue monitoring it, or what do you do?
If it's a very mild change and we feel that we have a reliable patient, we'll follow it. We'll have them come back at intervals of 4 months, 6 months, and just look again or repeat the pap and make sure it's not progressing. And in many cases, usually about 60% of the time, it will regress and they'll be fine. When we do find more severe disease, moderate or severe dysplasia, we do a local excision of the outer part of the cervix. And that's an office procedure done with local anesthesia. We don't believe it has a huge impact on fertility. There's been some studies that suggest it might be a little bit higher risk of preterm labor. Some other studies have suggested no, that's not really the case. So it's not it's a very easy procedure to do in the office, and I think it's very safe and very effective in getting rid of these abnormal cells, the dysplastic cells on the cervix. And then we continue to follow those women at more frequent intervals than the 3 years, just to make sure the HPV virus stays inactive or is gone.
Right. So it's fair to say then, if women are screened on a regular basis, that there's a likelihood that you will detect these precancerous stages and be able to treat them basically as an outpatient and monitor these changes in the event that it should be progressing.
Exactly.
Okay.
Exactly.
And also, as I introduced you, Jean, I mentioned that you're a member of an international organization for the prevention of cervical cancer. And we were speaking before the show, and you told me that you'd been in Kenya. So I think the audience might be interested in knowing how cervical cancer is dealt with in a place where they don't have pap smears, they don't have HPV vaccines and so forth.
Right. In many of the countries, the organization I work for is called Preventing Cervical Cancer. And it's a group that goes into areas that they're invited into the hospitals, and we train local healthcare providers, nurses, and what are called, I've forgotten the term for it's like a PA, the level of a PA in the hospitals. We train them to do these exams, and the exams are a little bit different in low resource settings because we don't have to do a pap smear. You need to have a pathologist or a cytotechnologist to interpret the pap, and in many countries they don't have that, or they do have pathologists, but they're very few and far between, and so it's not very practical to do pap smears. So the way that we screen in low resource settings is to apply vinegar, acetic acid, just regular household acetic acid to the cervix. We let it bathe the cervix for about a minute, 1 to 2 minutes, and then using a very bright light, we use headlamps with batteries, look at the cervix. And areas that are dysplastic usually will look white. They look different. And there's some different degrees of white that they can look. And so if we don't see any lesions, then we consider that a negative screen, and we ask the woman to return in a few years, and we'll look again. And we hope that our clinics will continue. The idea is to have them sustainable. If we do see a lesion, if it looks like a mild lesion, then what our group does is that we offer a same-day treatment. And for mild lesions, we'll do cryo, which is a technique where we freeze the cervix. And it's a very simple technique. It doesn't actually even use electricity. And that's been done, and the set is used in this country as well in some cases, although we're not doing it as much as we used to. But in the third world or developing countries, it's actually a very good technique to use for mild changes. If it's a more severe change, then we do the same procedure that we do in this country, something called a LEAP. And if we see something that actually looks like a cancer, we'll do a biopsy to confirm the diagnosis and refer the woman to one of the regional hospitals. And the sad thing is that many of those women aren't able to afford or get, it's either transportation or money that prevent them from getting the treatment. And many of these hospitals, I was quite impressed. I was in a very rural area in Kenya, and they had a whole wing in the hospital for hospice. And a number of the women that were there with cervical cancer, because it is very common in countries where they don't do regular screening. So our hope is to be able to introduce screening in enough places, and hopefully there'll be more of a train the trainer program where these individuals that we train will then go on and train neighboring communities so that more women will have the opportunity to be screened.
Just so I get a flavor, how common would you say cervical cancer is in your practice here in Falmouth?
We don't see it very often. We see precancer dysplasia a lot, and we're treating dysplasia on a daily basis. But actual cancer is much less frequent. It's less than one in this country. Frank cervical cancer is less than 1%. So we don't see it that often, but we sure spent a lot of time treating precancer.
And what was your experience in Kenya?
In Kenya, we saw cancer. We really did. We screened in the one clinic that we did. We screened 190 women, and we diagnosed. We had at least 2 that we know were cancer that we could look and we could tell that they had an advanced cancer. And those women, we hoped they got treatment, but couldn't guarantee it. So it is much more common there, and we also treated obviously a lot of precancers.
Okay. I'd like to ask Maureen, because Maureen really has spent a good deal of her professional life dealing with cervical cancer. She had a personal experience with her sister, and now Eileen is involved with Team Maureen. So Eileen, can you just tell us basically what your experience has been?
Yeah, so it all started about eight years ago. My sister passed away from relapsed cervical cancer. She initially was diagnosed when she was 34. She was at the time breastfeeding her second child, had some abnormal bleeding and discharge, but when you have when you're breastfeeding, you don't have a normal period. So she went to the GYN, and unfortunately there was a lesion, and ended up being treated with chemo, radiation, because in a radical hysterectomy because it had spread to some lymph nodes. She did have an adenocarcinoma, which is a little more aggressive than the squamous cell. So she had, prior to that, had done her screening, and it's just unfortunately that sometimes you miss in between. But she was in remission for 3 years, and then unfortunately was having back pain, and it had come back with a vengeance and was pretty much everywhere. So tried some chemotherapy, some relapse therapy, and just did not respond. And soon after passed away at age 37. And so then we started, at that point, to deal with our grief, we started a PAMAS Challenge biking team for the Dana-Farber Cancer Institute to raise funds for her her GYN oncologist. And we continue to ride, and we raised about just over $500,000 to specifically studies with cervical cancer. So it's really nice to see that Dana-Farber is coming up with these studies that are actually extending people that have relapsed therapy. So it's really exciting. But so at that point, we were really thrilled about that, but I was like, I feel like we need to do more. So the research is very important because I work there and know the importance of research, and certain agents were available that weren't available the first time my sister was treated. So, but I said, how can we get out there and really reach more people? And so we decided to really do more education and awareness, prevention. Education is power, and knowledge, and is the way that we felt to get out to the people that don't know this information. Because even well-educated people, the changes of guidelines are confusing. How often do I go and get a Pap test? And just the vaccines themselves, and new parents just really trying to understand what vaccines are about, and then a vaccine that's associated to an STI is even more scary. And how do we get the word out? And so we decided to work with Dana-Farber and now Cape Cod Healthcare to go out. We go to high schools. We have different community activities. We're there at races and talk to athletes and patients and providers, and we did a summit this year at the Dana-Farber to get education as well with the latest treatments. And so we're really involved in the Cape and the Boston area.
So when did you start Team Marine?
So originally the biking was 2008, but the nonprofit aspect of the education was 3 years ago, 2011.
And is most of the fundraising now towards education, towards helping fund clinical trials, a mixture of the two?
Yeah, so the mixture. So we have this amazing group of core bikers. A lot of them are physicians down here. Ken Caswell, my husband does it. Many other local, the Inmans. We have the same crew, and her husband and her daughter had done it for a few years. And so that money, you have to raise a certain amount of money, and most people raise it. And so some of their fundraising, if they can't reach their goal, which they usually do, then we'll get a small part of that. But most of the race and stuff we do is really for the educational, for the brochures, to go out to these high schools, to really goes into a lot of the educational materials and the stuff that we do with the schooling and stuff, that it really goes directly to that, which is great.
Now, what kind of work are you doing now with the vaccine?
Oh, so the vaccine. So we were part of the Department of Public Health got a grant from the CDC, the HPV initiative, to increase the vaccine rate. So that was, this ends in January. So they did an amazing job, and essentially all different organizations across the state worked together, and Team Marine was part of that. But unfortunately, the funding ends in January, so Team Marine is stepping up and really wants this momentum to continue. So with all our partners, Dana-Farber and Cape Cod Healthcare and American Cancer Society, multiple community providers are all involved. And so what we do is we're going to be housing the coalition. We are establishing an HPV cervical cancer and HPV-related cancer coalition. And what that is continuing to do the work that we've been doing. It's really networking and working together, getting into, like I said, the schools or other programs. There's colleges that are involved that do events to really get the awareness out. So it's really a nice thing that you can go to the Team Maureen site and has a coalition of our leaders, and if anyone wants to be involved, they can email us, and same other insurance companies are involved just to know what we're doing. So it's just a real nice group of survivors and advocates, and so we're all coming together and really just trying to do things to make the most impact. So we're not just doing little things and not talking. We're finally coming together as we did in the summit, and we only hope to make more of a difference down the Cape as well as in Boston.
So if people were interested in accessing your website, how would they do that?
Yep, so it's just teammaureen.org, and then there's a lot of educational things. I think one thing that we're very excited about is that we have reminders that you can get, reminder texts. So say if your child goes to the pediatrician and gets his vaccine and is told to get their vaccine, you can go into our website and you type in the date, and then you'll get a reminder. You can either do it email or text, and you'll get a reminder in a month that you can get it either this month or next, that you should get your second shot, and then in 6 months you'll get a reminder, say, make your appointment, you're going to get it. But you also nicely have a GYN reminder. So even though you're not getting PAP, this is a reminder to say, okay, this is a year. Are you supposed to be going back? Are you supposed to be going in? And then just to remind you either to make your appointment for, and then have appropriate screening depending on the physician. So that's really something we're really excited about that you can easily do on our site. And as well, there's a lot of educational materials on there as well, and quizzes, and it's different age groups so that anyone could look at it, a tween versus a parent. So there's different questions on the ages and stuff.
Okay.
So. Yeah.
Well, both Jean and Eileen mentioned the HPV vaccine, and this, to me, is a very exciting development. I think it's been the holy grail of cancer, really, is not only treating cancer, but now preventing cancer. And the first thing that happened was there was a link between the certain strains of the HPV virus and cervical cancer, and then lo and behold, a vaccine was developed specifically against these strains. So theoretically and actually, if people are vaccinated against all of these carcinogenic strains, we could actually not only treat cervical cancer, but prevent it. So it's critical that everybody who is of the appropriate age, which now is really everybody in the United States as teenagers, really is eligible to receive this vaccine. So Pete, I just want to ask you if you can just give us a little background about the vaccine and tell us everything you know about it.
Well, I like Mike, and I think everyone here, when this vaccine came out, I was like, this is amazing, because most of our vaccines are to prevent significant serious bacterial illness, meningitis, polio, measles, mumps, rubella, but on that entire list of vaccines, there was nothing out there for cancer. And when this came out, it was a game changer. So we thought it was going to be one of those ones when it came out and we started saying we have it in stock, that people would be lining up for this thing, and it was going to be like we may run out. But
when was that?
It was 2006. It was first FDA approved for girls, and then 2009.
2009 and then 2011
for boys.
For the boys.
And but it was seen as the new kid on the block, and it was also coming out after all the MMR and the autism questions. So it really didn't take off like all of us had expected.
So is the obstacle the concern about autism? Do you think is that still an issue?
It's just interesting, but there's a big there's a lot of misinformation out there on the internet, word of mouth, forums, and stuff about just vaccines in general. And there's a small but vocal group that kind of really is kind of been pushing against a lot, all vaccines. But the interesting thing, thanks to the MMR roar, that was studied to death, to the point where finally even the naysayers are saying, okay, I don't see any link between MMR and autism. And then HPV was kind of the next one, and since that one's gotten more attention, it's been now intensely studied for at least 7 years, and they just did a big Danish-Swedish study where they looked at 1 million kids, and there was no significant side effects to the vaccine other than a little soreness at the site, and some adolescents fainted. So really now, I think the push is now the other way, where people see where over 100 million doses have been given, So about 57 million in the U.S., but internationally 100 million. So at this point, like, you'd know if there was a bug in the system, you'd know if there was a problem with it. And I feel like the wave in my office, it's getting less hard to convince patients, of its safety, and it's not the new vaccine as much anymore. So I think those were the two things. It was new, and there was questions, but I think that's since it's kind of calmed down.
I think also that it's treating a sexually transmitted infection, and a lot of people felt that they shouldn't have to vaccinate, that that
Their kids are
Yes.
never
their kids aren't going to be sexually
So-
active or whatever.
Yes.
So-
So I'm curious to know, so
Yeah.
the idea is that if you consent to the vaccine, you're tacitly consenting to sex. Is that the thinking?
Well, it's definitely, it's definitely one of those ones when I'm trying to kind of push it on the 11 and 12-year visits. And I really see in their people's eyes to say, well, what's that for? I'm like, well, it can prevent cervical cancer, this virus, HPV. And they'll say, is that from, sexual activity? I said, well, it's from skin-to-skin activity. It doesn't have to be sex, but I said, yeah. And then parents go and they look at their little angel, their 11-year-old, and they're like, no, not my girl. So then I really get into the analogy. I use the analogy of like the bike helmet thing. And I say, like, listen, well, when are you going to put your bike helmet on your kid? Are you going to put it on it before they get on the bike? Or after they've, gotten in the accident and stuff. So I really say we want to get it before your kid's sexually active. So, and I also point out there was a study looking at, they did a group, I forgot how big it was, but.
Yeah, I think it was a couple thousand.
So a couple thousand kids, and they looked at when they gave the HPV, they had them fill out, are they sexually active before and after. And it wasn't some now green light, where suddenly they all went and they became sexually active because their parents said okay to a HPV vaccine. So in the end, that study showed that it is not any sort of
Catalyst.
catalyst to them being out there.
Is it still an obstacle, though, do you find, in your practice?
It is, and again, I think it's anything dealing with sex. People have some prejudices and some fears. And like I said, I use that bike analogy, and they go, "Oh, that makes sense." So my little angel, is never going to have sex, but let's do it before they get married.
Right.
So, that's been effective.
And when is the vaccine given? What is the correct time to give it?
So as we talked a little bit, it's licensed down to age 9 and as late as age 26. One of the things that came out of this HPV summit was showing that, because I used to be more casual in my advice, and I kind of anytime I could get it, I tried. But they're really pushing it out for 11 and 12. They see that they have a stronger immune response to it, to the point where they see that even after 2 shots, it's equal to someone if they're like 18 and they get 3 shots to complete the series. So we're really pushing it around 11 and 12.
So it's not just before sex. The idea is you want to get the most robust immune response, and that's the age to do it.
Yeah, so 11 and 12. As long as you complete your series before 14, that seems to be the where they have the biggest immune response.
And you said 3 injections. Now, is there an interval that needs to be done?
Yeah, so you get it at time 0, and then you get it 2 months, 1 or 2 months, but most people do 2 months later, and then 6 months after the initial shot. You can extend it later. Some people forget and come later, and that's still okay. You don't have to redo the series. But the closest interval with time 0, 2 months, and 6 months.
Now, is there a need for a booster? Do the antibodies wear off? Do we know that yet?
Good question. So far, what they're saying is that it looks like it's adequate protection 6 to 8 years. And I think, like anything, they're going to follow it going forward. And then if they find that after 10 years people lose their immunity, they may give a booster shot, much like they do with chickenpox and tetanus and that kind of thing. But right now, it's the 3-shot series and done. But we'll see.
And do insurance carriers mostly pay for it?
Yep. So right now it's awesome. All insurances are on board and have been for years, and so it's paid for. If you're in a situation where you have to pay out of pocket, it costs about $130 per shot. Plus, there's usually an administration fee that gets you to like $140 or $150. But if it's for a chance to prevent cancer, I think that's a good investment.
Right. Now, in your experience, you said it's well tolerated. People maybe get a little bit of soreness in their
Yeah.
arm. You said a few people have fainted, which
Yeah.
is not unusual. And I know when people see a needle.
Yeah.
Anything that people should be
Adolescents.
concerned about?
Yes,
besides
the
that?
biggest thing in the studies has shown it's redness, soreness at the site. Initially, there were some fainting spells, but then they since said, we want anyone who gets an HPV shot to kind of sit on the table or sit around the office for a little bit. And I can't remember the last time we've
I
had
don't
anyone.
think we've had anybody with the problem. either,
15
really.
minutes they're supposed to, so that
Yeah.
side effect went away after
Yeah.
sitting.
So no, it's kind of the typical, like any shots, any of the vaccines. It seems to be just like a little soreness and.
And I guess the new development that we were just talking about that is that the DEA now has approved a stronger vaccine, actually. It has
Yeah.
more of the cancer-causing strains of the HPV virus.
Yeah.
So can you talk about that just for a second?
Yeah, so the first one that's was approved in 2006 had 4 strains that it covered, and that gave you about 70% protection against cervical cancer and 90% for genital warts, which is also an HPV related. So the new one is, they call it Gardasil 9 or HPV 9, and it adds 5 more, and it gets you up to 90% protection on cervical cancer, and then they're quoting something like 100% for the genital wart. So I mean, it's a great development to go from 70%, 90%, protection. It's fantastic.
Right. And also, what about the mouth-throat connection with the HPV virus?
Yeah.
What is that about?
So it's interesting. The more and more data is coming out showing that this nasty virus is connected with anal cancer, oral cancer, oral pharyngeal cancer, mouth cancer, and in fact, everyone knows about nicotine, smoking, and mouth cancers, but HPV has now, I think it was a year or 2 ago, just surpassed as far as it's a higher causative agent for oral cancer than nicotine-based things. So it's just more evidence, or more evidence that this HPV vaccine can prevent not only cervical cancer, like we've been talking about, but anal cancer and mouth cancer,
And the same vaccine will protect. The same vaccines given to girls for cervical cancer will also prevent boys and girls
Yes.
from getting cancer of their mouth and throat. Is that,
Yes.
is that correct?
Yeah,
Okay.
and that's why it was originally for cervical cancer for women, and then the FDA approved it for males, and so now essentially across the board, anyone aged 9 to 26 can.
And part of the reason to treat both men and boys and girls really is to try to reduce the amount of the prevalence of HPV in the population, because currently it's about 60%. I don't know if that's the number you have, but
60.
yeah, that of young adults, at least 60% of them have been exposed to the HPV virus, and if we can vaccinate both the boys and the girls, the hope is that number will go way down,
Right.
and so there'll just be that much less risk all around.
Yeah.
And then the push for the head and neck is that when they did the report, the NCI, that it's the one cancer that they're seeing increases in HPV-related cancers and deaths. And so at Dana-Farber, the head and necks, they're seeing about 75% are related to HPV, whereas it used to, as you said, was tobacco and alcohol, but that's not what they're seeing. So that's why it's gone up 225% since the 80s up to now, the incidence of head and neck cancer. So that's why they're very concerned, and we definitely advocate, and that's why I think the boys are really pushed as well now about that.
Yeah.
I mean, I could just tell the audience my own personal experiences. My uncle, when he was in his early 50s, never smoked, never drank. He was very athletic, developed cancer of his tongue. And we now know that it was actually an HPV-associated cancer, although at that time it was not really known. But they've since tested, actually, the tissue, and it was an HPV-associated cancer. But, I remember seeing him in the hospital, and he was quite athletic, and he'd lost more than 100 pounds. He had a tracheostomy, a hole in his throat, a tube in his stomach. and he had these needles sticking out from the bottom of his mouth because they were treating the cancer with radiation, and his tongue was actually pithed by these, and he couldn't, obviously couldn't talk, and he had to be in a room by himself because of the radiation. And he had his own suction device, and he was in that room for about 7 to 10 days.
Wow.
And then he had to have external beam radiation, and he survived, but it was quite a battle. And we've talked about this recently, and he said, God, if they had had a vaccine, the misery that it could have prevented in his life. But it's something.
Yeah, I think until it hits you personally,
Yeah.
and it doesn't make you reflect as much on
Right.
on what could have or shouldn't have happened.
Absolutely. So, Eileen, I also want to talk, ask you just to talk for a minute, if you could, about the documentary.
Yeah, so we're very excited. It's called Someone You Love, and you can see right there. We're having at the Falmouth Senator Pub right in Falmouth, so graciously are hosting it on January 5th. It is from 6 to 8. It's about an hour and 20 minutes, but one of the participants in that will be, who's a cancer survivor, will be talking afterwards to answer questions. So what it is it's 5 different women diagnosed with different stages of cervical cancer, and it follows some of them through their journey of treatment. It's really, I think the main goal is it really does a nice job educating about HPV and how it can affect your life and relationships, and how, you know, what could have or could potentially have been prevented. I just think it's it really speaks to vaccines and answers questions about transmission and a lot of the psychosocial aspect, the stigmatism that it comes with HPV as well as cervical cancer. I think it's very well done because it's a nice mix of the educational, but then the personal piece, and it's pretty inspiring. These women, you know, it's hard to watch being a sister of someone that has lost someone, but I think that's a good job then if it's that hard to watch. But it really, you know, I think for anyone that needs to learn information about HPV, for their kids to make the best choices on their vaccine, or for their own screening, to just really appreciate that, you know, if it's caught early, you have a great chance of living. If it's metastatic, you have a less than 15% chance of cure. So I think if you can prevent this, and this is a nice way to really, I just think there's so much misunderstanding, and it's such a widespread virus that comes and then goes away. And like you said, like we said that if it goes away, which it most does, you shouldn't have a problem. But if it doesn't, you should make sure you're doing the appropriate screening and be educated about what signs you should be looking for. So I just think it's a very well done and powerful movie that I hope people come and see. And it's free, and you can eat dinner and get milk duds and whatever else you'd like to do. And the other thing is, we're very thankful to Team Marinas because we really have done a lot more and been able to because of the Paul Liverusso Foundation has gave us money to support our new website, which is amazing. That's the easiest way to get your word out, as well as our executive director, Kelly Welch, who does so much work, and I don't know how we could do it without her. So she's in charge of helping. So you can go right on Team Marine's website and get it. It has the code that you can just use your iPhone and register before, just because it is limited space. But we hope that people will come and learn from it, and there'll be many medical providers there as well as survivors. And I think, you know, to ask any type of questions that we'll be happy to answer.
So this is it's a documentary about 5 women with cervical cancer. It's narrated by Vanessa Williams.
Yeah.
I've seen the documentary. It's really high quality, extremely well done. It's very moving. It's extremely educational, and it's inspirational.
Yeah.
So if people want to watch it, they should go to Team Maureen
Yeah.
and register online.
Yeah.
It's free,
It's
but you have to
free.
pre-register.
Yeah, just so we know how many people that are
Okay.
going to be there.
So that's January 5th.
Yeah.
6 to 8.
o'clock. Yeah.
Okay.
Free admission.
You should have everybody seeing that because it's really, it's a very
important
moving
message.
documentary. Okay, well, I want to thank my panelists here. It's been really, I've learned quite a bit from you guys. I just want to summarize that, you know, we started talking about cervical cancer before the pap smear, before the HPV vaccine, #1 killer woman in the United States, still a major killer worldwide where we don't have the pap smear and the vaccine. Since the pap smear, the incidence went from the mortality actually went from 35 per 100,000 women, now down to between 2 and 3. And with the vaccine, we could really eliminate it. It could go the way of smallpox. It'd be a great thing.
Very good.
Okay, well, thank you guys.
Thanks.
Thank
Thank
you.
you.
All right.